Okay, I'm back. So today I'm going to talk about the things that I feel dental school didn't prepare me for in private practice. Now, personally, I had a really good experience. I felt really well prepared after dental school, and I'm very grateful for what I was taught and what I learned and what I was exposed to. Um, and I actually think the protocol in dental school was a lot tighter and stricter than private practice. Just to mention a few things such as consent, review appointments, patient care, reaching out to patients. I feel like that was well handled in dental school. And that's due to requiring a certain number of um, surfaces to be completed regarding fillings or root canals and crowns. I think the quotas really helped the students stay on top of things patient wise. And yeah, I think that was well dealt with. But there are a few things that I feel like we just had to learn on the job, or I'll at least speak for myself. I feel like I had to learn on the job. One of the main things is taking charge or being independent. I feel like there's many ways to skin a cat. A lot of the times I had to have decisions revised by supervisors and mentors. And I personally think that independence is a muscle that has to be built by the individual. If you take, for instance, a patient that comes in with a swelling, let's say it's non-life threatening, there's a little bit of pus, you can prescribe that patient an antibiotic, or you could drain the swelling chairside. In dental school, if I were to make the suggestion that, okay, prescribe the antibiotic and bring the patient back maybe in a week's time, the supervisor is well within their rights to say, well, you can just drain the sinus, drill an access cavity, or just get a scalpel and drain the sinus or drain the swelling. But it's nice to have that alternative. At the same time, it's good to practice that autonomy because it's important and it's needed. Another thing I would say is it's not always black and white. I feel in exams or even in orals, a lot of the times we had to give a definitive diagnosis or we had to get to the bottom of things. Like, okay, if it's not pain relief medication, then it's an antibiotic. And if it's not an antibiotic, then it's a root canal. If it's not root canal, it's an extraction or it's unrestorable. It's like you have to come up with these definitive terms. And I just feel that's just not the case in private practice or in reality. A lot of the times symptoms are developing. You're not sure, like the patient's having a concussion of these symptoms that could be either acute or chronic, or it could be something else entirely. And I feel like that was only really pushed in my oral medicine module, where if you had a presenting ulcer, you'd be inclined to wait a certain amount of time, let's say 2 weeks, before revising the patient's symptoms or the appearance of the ulcer. But I wish that was built into us a little bit more, that waiting before coming up with the definitive diagnosis. Another thing I felt I was unprepared for was how evolving dentistry is. Dentistry is fast developing. I look at things like digital dentistry in restorative, like we can make in-house crowns, in-house onlays, inlays. We have 3D printers, scanners, which is an exciting world. But I just didn't feel like I was exposed to that in dental school. And of course, these things are expensive. Like scanners are upwards of 20,000 euros, 50,000 euros. Prints like the sprint rate printers are very expensive and dear as well. But I just feel it would have been nice to be exposed to that, because I had to take mini courses and go on workshops to learn these things. And this was demanded of me in private practice to use this equipment. And straight out of graduation, where you're still learning how to do like an extraction or first stage endo, like not learning, but getting comfortable and getting fluid doing these treatments, to jump into something like scanning for like an upper right bridge, kind of like, I just feel it would have been nice to be exposed to some of these things. Or even with orthodontics and aligner treatment, patients can can literally scan their teeth with their phone and upload it onto a system, and the orthodontist can monitor the progress of the alignment. And just to name a few things, those are fast developing technologies in dentistry. I wish I just was exposed to it a little bit more in dental school. Um, I'd say another thing is taking days off. I just feel like a hamster in a wheel at times. Like, your manager's not going to come up to you and say, look, you've been working, for the last 6 weeks, 5 days in a row, you need to take a little bit of time off. No, it's up to you to make that decision. And, by the nature of our job, we have patients booked in, we have appointments scheduled. You do have to plan in advance, and you can kind of just get lost in the, okay, checkup, cleaning, root canal extraction. And your back can start to give, your neck starts getting sore, you start getting cramps, you feel a little bit more groggy in the mornings, your weekends are spent recovering and resting. That should have been heavily emphasized in dental school. Taking time off, structuring your day, structuring your book, how to communicate with your employers, how to communicate with your staff, and I think that should have been really pushed. I think lastly, what else do I wish was kind of touched in dental school? I think just career guidance in general. Like, I wish they did have specialists and advanced dentists come in and give talks and talk about their specialty and why their specialty is great and stuff. But I really wish we got both sides of the coin. I really wish we had the specialists who wish they started sooner, who wish they started their specialty a bit later, who regretted their choice, who are happy with their choice. Because, I'm approaching 2 years in private practice, and it's like I know I like surgery, I know I like restorative, but like, when is appropriate? When do I truly know that I'm ready to get into a 15,000 euros a year program to learn something that I could technically learn in workshops? I just wish there was a little bit more guidance and information shared in dental school, because I'm at a crossroads right now and I just don't know if I'm being too hasty or if I'm rushing. But yeah, those would be my reflections. That's what I feel. Yeah.